And with cases on the rise again, more patients ending up in the hospitals and dying from the virus, federal regulators are now pushing forward with a plan, assuming a vaccine approval hopefully is not far off. The CDC has settled on official recommendations. That happened this afternoon, with healthcare workers and nursing home residents first in line. Andrea Lucia starts us off looking at the difference that could make for their families.
I was like, oh my God, like they're the vulnerable population.
As soon as the first COVID-19 cases started popping up in U.S. nursing homes, Rosie Davis got scared.
The first thing I thought about was my mom.
Months later in May, she watched her mother wave goodbye as she was wheeled into an ambulance. It was the last time she'd see her before COVID claimed her life.
My mom was in a nursing home. My mom was my mom. She was the most important person in my life.
The roughly 3 million Americans living in long-term care facilities have carried an unproportionate burden. They account for less than 1% of the U.S. population, but an estimated 40% of COVID-related deaths.
Dr. Szilagyi.
Szilagyi, yes.
Today, in an emergency virtual meeting, the CDC's Advisory Committee on Immunization Practices voted to recommend adults living in long-term care facilities be on par with healthcare workers to be given the very first access to a COVID vaccine.
There's so much hope in today's announcement with respect to just how this could unfold for older people in this country.
Katie Smith-Sloan is president and CEO of Leading Age, an association of nonprofit providers of aging services. That includes many nursing homes who've been working to protect the country's most vulnerable population.
So it is a challenge. It's created great heartburn for a lot of families, particularly when there's no visitation and they've had to connect with their family members through a Zoom call or an iPad or, maybe through a window.
The promise of a vaccine, not months, but weeks away, offers hope.
I miss my mom every day. I would give anything to have her back. People in nursing homes, they matter. They matter.
Rosie says she does worry about how safe the vaccine will be for an already medically fragile population. For her, it's more important that the staff at nursing homes gets it. We've learned even among healthcare workers, they will be right there at the front of the line to be vaccinated. Andrea Lucia, CBS 11 News.